Hi, this is a continuation of the perineal trauma. In our last video, we mentioned some effects of untreated perineal trauma, complications of perineal trauma, where we said that we could have urethral, we could have cystocele, rectocele, dyspareunia, stress, incontinence, and sometimes they have a way of even affecting the woman's self-confidence. So it's very important that we know how to prevent perineal trauma in labor as nurses and midwives. Okay. Now, the first thing we are going to do is to start from the antenatal. It's very important. So from the antenatal time, we also want women to have care providers that are compassionate about their care. Okay, that makes women feel more comfortable or create a very good therapeutic relationship with their clients, such that the women feel good, feel empowered, and in control of their labor process. In that case, they comply with every instructions that you give them. Okay, and we are likely to have reduced trauma. Again, in the antenatal period or in the pregnancy period, we want to avoid certain complications like treating anemia, because if a woman does not have anemia, it means that we have enough iron stores that can perfuse these perineal tissue, perineal muscles. Okay, and a healthy tissue is one that can withstand these pressures and have a reduced rate of being traumatized. Okay, so very, very important. Then when we come into labor, we also have a role to play. So in labor, in first stage of labor, what you want to do is that you want to encourage your client to empty the bladder. Full bladder could affect the perineal mouth. You could have trauma. So at all the stages of labor, full bladder is not encouraged. So encourage client to empty the bladder. Okay, and again, in the first stage, you want to encourage your client to avoid pushing through undilated cervix, and sometimes they could have the edge of pushing, and the edge could be very strong as the fetal head is pressing on the sacral nerves that supplies the rectums as well. So you have that edge to like push, and we also learned that sometimes when they push, it brings them some form of relief. Okay, so you could also help them by helping elevate the foot end of the bed. Okay, to reduce that sensation for them, and sometimes they can change the position, have positional changes to reduce that sensation, so they don't push through undilated cervix. Are you getting? Now in second stage, what do? We have to also make sure that we confirm full dilatation before the woman is made to push. So when you position the woman, please do confirm that the woman is fully dilated, so that it will reduce perineal trauma. Again, if you are in second stage or managing the second stage client, make sure that you take hands off the perineal as much as you can, so that the perineum as a stress does not further get traumatized. I hope you get it. Yes, then when you are delivering, you are supposed to make sure that you use the proper mechanisms of labor. Always make sure you are maintaining flexion, so that you have the smallest diameter of the fetal head engaged, like crowning and coming out. Okay, so that we don't traumatize this perineum. I hope you get it. Yes, so all this is going to help. Now in the second stage too, you want to also encourage the woman to breathe out the fetal head. So when you say breathe out, the woman will take shallow breath, okay, and not forcefully push the baby. If you push the baby forcefully, you increase your risk of traumatizing the perineal tissues and muscles. Okay, so the woman has to breathe out the baby's head, rest in between contraction, and breathe out baby's head in a very controlled manner to reduce trauma. I hope you get it. Yes. Now in third stage too, we have to also remember to make the woman empty her bladder. But even before the third stage, in second stage, as you examine the perineum, remember to give a timely episiotomy. Even though episiotomy is a form of trauma to the perineum or the perineal tissues and all that, but it is better than letting the woman have extensive tear. Okay, so you have to assess very well and give timely episiotomy. Then afterwards, you have to suture the episiotomy and encourage the woman to engage in good hygiene practices, change perineal pads, eat balanced diet, have mild exercises to help these wounds perfectly, so that we don't have any complication. Thank you for joining. Thank you for watching. Stay tuned. We have more in store for you. Bye.